Hello, welcome to Preventive Healthcare. I am Umanath. In this video, we will see a very important chronic health condition called chronic asthma and wheezing. Is there a cure for chronic asthma and wheezing? The straight answer is yes. How long does it take to comprehensively address this particular condition and restore the normalcy of the lower respiratory system? It takes roughly 6 months. Can it be done for people who are suffering for several years or those who have started suffering only in the recent past? In both the cases, the answer is a full yes. What is the success rate when we treat these kind of people? The success rate for the age group up to 55 years, from kids to up to 55 years, is more than 90%. Only when the age band increases beyond 55 years, the success rate is somewhere around 60%. What I intend to do in this video is to share some of the experiences that I have seen as a part of my practice while treating patients with chronic asthma and wheezing. This can help you to understand this condition better and also think about permanent solutions to come out of this chronic condition. Let me start with an example of an adult who was in his early 50s, suffering from chronic asthma. The suffering was more than 20 years, somewhere around 25 years of chronic health condition that was giving a lot of trouble during various seasons of the year. And I saw this gentleman, he came to me, and then when I did a complete diagnosis and tried to understand where his lower respiratory system was there, he was going through symptom management recommended by pulmonologist. The symptom management is usually with the equipment, usually with a tool called puff and as well as certain medication. This puff helps him to suppress or reduce the asthmatic attacks. Same way the medicine also. So whenever the condition flares up, he uses this. And this was going on for several years. I think we need to understand the difference between what is a chronic condition and what is a short-term condition. Chronic condition is a long-term condition, like asthma and chronic wheezing. The short-term conditions are like infection in the lung. It could be pneumonia, or it could be bronchitis, or any other severe congestion in the chest, which is causing breathing difficulties, including cough, breathlessness, and so on. Normally, when we get problems in the respiratory system, especially in the lower part of the respiratory system, when I say the lungs, we go to pulmonologist. Pulmonologists and asthma specialists, they treat both chronic conditions as well as short-term conditions like pneumonia, bronchitis, and any other issues in the lungs. But unfortunately, we need to understand the broader picture. The short-term conditions are happening most of the time because of external causes. When you say external causes, there are certain causes which causes your infection in the chest, and then that can become a problem like a pneumonia or a bronchitis or any other issue. So when a pulmonologist is treating with short-term medications, let us say for 1 or 2 weeks, once the chest becomes clear, you come out of the condition. And anything any other issues also including fever associated with the infection, then you are fine. But the same kind of methodology is not going to work out for chronic conditions like asthma and wheezing. In case of asthma and wheezing, the root causes are within your body. Root causes are originating inside your system, not from the outside your system. But sometimes doctors say so. Why they say so? They talk about dust, they talk about pollens, they talk about pollution. Yes, I agree. These kind of external factors can trigger the asthmatic attack or can worsen the asthmatic attack, but they are not the causes. Please understand. Triggers are something like the spark, and the condition is something like the fuel. Unless otherwise you have the fuel inside, the triggers may not spark severe asthmatic conditions. So still, the best and the long-term solution is improving things internally, not by suppressing the symptom or avoiding the symptom or trying to escape from the symptom. That's not going to happen in the long run. This is one of the reasons why pulmonologists are not able to address the root causes of asthma. So they start practicing the symptom management. And you also start following the symptom management, and that becomes your part of the life for the rest of your life. That is what this gentleman was doing. Okay. So when he came, his question was, is it possible to come out of this completely? I said, yes. How long does it take? I said, the changes will take roughly 90 days. And you will be able to come out of this in 6 months. And he was able to stop the usage of puff right from the first week. And he never touched it after that. Now it's more than 4.5 years. Still his system is stable and absolutely fine. How can this happen? This can happen only when we try to understand the root causes internally and try to apply a preventive healthcare approach holistically and giving a tailor-made and customized solution for that individual. As long as we continue to do the symptom management by suppressing the symptoms of asthma, by suppressing the symptoms of wheezing, we will continue to have the symptom management as a part of our life. If you want to get rid of this kind of symptom management, if you want to have a respiratory system that is absolutely in good health for the rest of your life, please look at approaches like preventive health care. Let me say one more example in my experience. A lady came with a kid. The age was around 11 to 12 years of kid. The lady her age was around late 30s, maybe around 37, 38. When they came, they were also complaining the condition of wheezing for this child, and the doctor has recommended, as usual, the puff and medicines, and that she is using it. And the unfortunate part is that she was asked to do this for the rest of her life. And I think it is very difficult for me to imagine when you say this to a kid at the age of 12 and you need to have this for the rest of your life. If there is no other option, I am okay with that. But there are beautiful solutions, comprehensive solutions, which can look at the root causes at a broader level and try to address holistically, which can help the kid to restore the respiratory system health and remain absolutely healthy for the remaining lifespan. And this is a very interesting case. The lady told me that she is also having this chronic wheezing. She is also doing the symptom management. And over and above, she also told that her mother, who is in her early 60s, okay, grandmother of this kid actually, she is also having this problem. So the problem is there in 3 generations: the grandmother, the mother, and the child. And all are being treated by the pulmonologist. Now the question arises, if the asthma and wheezing is in your family history, is there any solution for you to address even if it is happening in the family tree? The answer is yes. Most of the time, yes, provided if we address these kind of conditions at an early age. So, subsequent treatment with a very specific protocol to restore the lower respiratory system health help the kid to come out of the crisis completely, in spite of their family history of having chronic asthma. And you may be wondering, if the solution is there, why people are not practicing? People are more used to symptom management. And doctors are also more used to symptom management. Let me say why. The chronic asthma condition is falling under the specialization, under the domain of pulmonology and respiratory medicine. And unfortunately, the symptoms are falling within the domain, within the specialization of pulmonology and respiratory medicine. But the root causes of chronic conditions like asthma and wheezing goes beyond the domain of pulmonology and domain of respiratory medicine. This is one of the main causes why they are not able to address comprehensively. This is one of the reasons why they are not able to resolve the condition completely. They resort to symptom management. I am not saying this as a blame game. I am saying this only as a plain fact so that we all know what kind of long-term solutions are available. And the ignorance can make us suffer for the rest of the life. And is it really required? I don't think so. Now, some of you may have the question of success rate. I find that the success rate is pretty high. More than 90% of the cases of chronic asthma and wheezing up to the age of 55 can be resolved permanently. And the respiratory system health can be restored completely. Only when the age is beyond 55, the success rate comes down. And it is somewhere around, still I would say, 60% of the cases can still be brought back to normal. And why that is happening? Because they left the system completely unattended and only doing symptom management for a very long period of time. That has weakened the other systems also. When somebody is managing symptom management for several years of decades, it also reduces the health of the other systems like the cardiovascular system and also the immune system and so on. Then it becomes a little more challenging beyond the age of 65, 55. But almost, I would say more than 90% of the cases can be addressed if the age is less than 55. And how long does it take? Even if the asthma is there for 25 years of suffering, still it can be brought back to full normalcy, most of the time in a time frame of 6 months. The error of judgment can go plus or minus 1 month, not beyond that. And I've seen that a number of times. And the time frame, what I am saying, is surprisingly low. That is what I have seen. And in real life, I felt that, though I say 6 months of time frame, majority of them stopped using the symptom management methods like usage of puff and the medicine even before 3 months of starting the comprehensive protocol. Okay. By doing the same practices again and again over a period of several years, we will be getting the same results of symptom management, not cure. Unless otherwise, we are open enough to see the other methods which can help us to address the root causes and which can help us to get back the health of the respiratory system, the symptom management will continue to happen. So be very clear. Where the pulmonologist can help you to solve the conditions completely, he can help you to solve the conditions completely in case of bronchitis, pneumonia, other chest infections. Yes, of course he will help. No doubt about it. But in case of chronic conditions, they can help you only for symptom management, not for resolving it completely, not for curing it, not for getting back the normalcy of the respiratory system. This we all need to understand. So restoring the health of your respiratory system from chronic conditions is in your hand. I can help you. I provide a detailed assessment on a case-to-case basis when I see and diagnose an individual and come out with a very specific treatment protocol which is holistic, at the same time following the principles of preventive health care, will address the root causes and help you to get back your respiratory system to normalcy. This is what I've been doing. And I think this video has given you a completely different perspective of how to see asthma and wheezing. If you find this very useful, please share it to others and click the bell button and subscribe to get more videos which will help you to improve your understanding, which will help you to address various other chronic health conditions. And I'm planning to give more inputs in the subsequent videos on other chronic conditions where preventive health care can help you to come out of it completely. Thank you.